pleasure to welcome you all to our webinar today. I'm Dr. Emily McCobb. I'm the Assistant Director of the Center for Animals and Public Policy here at Tufts. And I'm really excited to get to introduce Dr. Jennifer Ogeer. Dr. Ogeer is currently the Vice President of Medical Science and Innovation at Antech Diagnostics, but she's here today to talk about some of her volunteer work that she does as a board member with Veterinarians Without Borders, Canada. Dr. Ogeer graduated from Ontario Veterinary College in my era, and we can kind of claim her a little bit at Tufts because she completed an emergency medicine and critical care residency at Tufts and Angel, which is actually how I first met her. She was the first resident in emergency critical care that I ever worked with, and actually owe her a huge debt of gratitude at helping me survive my internship. Since then, she's worked in a lot of different settings. She's been in academia at Western College in Canada, also at Texas A&M in the US. She has a lot of business training and has worked for a number of different sectors in the veterinary industry. She is currently, she also served as the chair of the board of directors for the Oakville Milton Humane Society in Canada. So she knows a lot about our work and our world in animal welfare, and is currently the chair for Veterinarians Without Borders in Canada, part of Veterinarians Sans Frontières, which is an international organization. She's also the vice chair and treasurer of the Ontario Veterinary College Pet Trust Advisory Board of Directors. She's extremely committed to promoting diversity, equity, inclusion, and belonging in veterinary medicine, and is the incoming vice chair of Diversity Veterinary Medicine Coalition, an executive member of Black Veterinary Professional Association of Canada, and a board director for the Mars State of Pet Homelessness Index. Please welcome Dr. Ogeer, and the floor is yours.
Thank you, Dr. McCobb, and thank you, Jenny. That CV sounds as though I have a lot of free time, which I don't, and I don't actually want to know what I want to do when I grow up. But thank you. So I want to just introduce a little bit about Veterinarians Without Borders, and thank you all for having me here today. This organization was actually founded in 2005, where we actually had a small group of passionate advocates for animal, human, and environmental health who really decided they wanted to try to change the world, a big task. And so now our work at VWB spans everywhere from Canada's Northwest Territories to the Sub-Saharan Africa to Southeast Asia, and today in the Ukraine, which I'll be talking about. Our organization has really grown into a collective of passionate advocates. They're dedicated volunteers that go around the world, and we have generous donors and supporters who work in collaboration with our partners around the world to create healthy animals, healthy people, and a healthy planet. That actually is our mission statement. We firmly believe as an organization in the One Health approach, which recognizes, as many of you know, that humans and animals live in a shared environment, and there is value add to be gained when we work together on these health issues with a wide variety of both local as well as international or global partners. With work happening in over a dozen countries around the world, our projects are supported by individual donors and benefactors. We also get donations from foundations, government, and as well as corporations across the globe. And all our work is community-led. It drives local sustainable solutions, and it spans the international development as well as the humanitarian sector. Currently, our staff includes 13 individuals who are now all working remotely across Canada in various provinces. And we have an extremely dedicated board. I'm proud to be the chair of this dedicated team and passionate individuals who guides our work and really has supported everything we do endlessly so we can lift up our programming both locally as well as globally. VWB Canada is actually part of a larger family that is called VSF, or Veterinarians Sans Frontières International, that has 13 members. And so together as a network, we operate in 40 countries. And in 2021, we had about 2.02 million direct beneficiary households. We've now supported over 4,790 animal health professionals, including 3,515 community animal health workers, treating nearly 24 million animals. So here's a quick snapshot of our global presence from Vets Without Borders Canada. In Canada, we actually work in the Northwest, in Nunavut, as well as the Northwest Territories. In Africa, we work in Kenya, Ghana, Senegal, and South Sudan. And in Asia, we work in Cambodia, Vietnam, Laos, Pakistan, and in Europe, we currently are working in Romania as well as in the Ukraine. So our work globally is really guided by the communities in which we work, and that allows for a really participatory and inclusive approach to development. And globally, there's 1 billion people who are dependent on livestock. That is their livelihood, and it's the backbone of agriculture. It is the major productive asset for these pastoral communities, particularly amongst those that are the most vulnerable low-income households. So in Southeast Asia and Sub-Saharan Africa, our work focuses around these pastoralists and small-scale farmers. More than 90% of food animals are raised by subsistence farmers, and the majority are the women who have very little access to animal health services. And so, as we all know, the continuing growing population will need more than 60% more food than we currently have by 2025. And in the Horn of Africa, there are over 22 million pastoralists, of which 65 depend on livestock for their livelihoods. In addition, 75% of their milk and 60% of their protein comes from these smallholder farmers. So these small-scale livestock producers in the South have very little or no expert support in the care of their animals, particularly when it comes to animal health. So producers in the developing world remain poor because they are so vulnerable. They lack the necessary support to prevent or to cure diseases in their livestock, or to even maximize the benefits that their livestock can provide. So our work addresses these vulnerabilities by improving the livelihood, the health, and nutrition of some of the poorest communities through the care and the management of animals. And this directly improves the economic outlook for marginalized people, increasing their food security. So I'd like to play a video now that actually shows a little bit about what we've been doing. I may not show the entire video, but I'll start it so you can get a little glimpse here of what's going on.
Since the time I was with the Vets Without Borders, that is after they left, we've settled so many cases of mastitis because the trainings that the farmers were given and the advices they were given by the Vets Without Borders, several cases have stopped for mastitis, and most of them were caused by the hygiene, and they have improved. We've also seen the reconstructions, that is changes in housing for cows. They have improved so much on their zero grazing, and they are working wonderful. We've also seen so many changes on the type of feeds the cows have been feeding there before. So many of them have turned to silages and napier grass that is 1 meter high, because so many of them could feed on napier grass that was too long, like sugar canes. But for now, so many, actually, 80 to 90% of the farmers have changed to 1 meter feet high for the napier grass. That has encouraged so much. And due to that, we've improved this in milk production, because that they were taught that the napier grass has all the nutrients that the cow requires. We've also had so many changes on our young stock management, whereby when they were taught on how to manage the calves, now we can see our heifers can show heat. That is when they are 300 to 500 kgs, because they were taught on how to take the body weight of our cows so that they can reach the maximum kg that the cow requires for it to have to show the heat. And they were shown. Actually, I was left one of the tape measure that the farmers were taught on how to use it to take the weight for the cows. And the one that I have, it was from the Vets Without Borders, that they left it with me so that they can be it to our farmers. And that is this one. It works wonderful. I've shown so many farmers, they are working with it, and they were taught by the Vets Without Borders. And when I do the follow-ups, I actually see them. Most of them bought this one. And it is doing well to our farmers, and they appreciated especially when they know the weight of their cows. Because they were taught when they know the weight of their cows, they'll be in a position of knowing on how to deworm their cows.
The milk production, when they visited our farm, we used to do about 40 liters. Currently, we are doing about 150 with the few animals, with the same animals. In fact, not the few animals, with the same animals. With good management, we tripled the production from 40 to 120, and we are hoping to go further. So I can say that we haven't had any case of mastitis in the farm because they taught us about good hygiene practices. Also, there's a knowledge they gave us, which was my first time to encounter it, about the mastitis test. What they call it, CMT. Yeah. So they taught us about CMT, and I've been trying to use it to see whether there are cases of mastitis, but we haven't had any. Yeah, but in the area of sleeping animals, that one I give them credit because that one we nurtured it the following day by removing the stop bar from 2 feet down the ground to 5 feet. And the animals, they normally sleep comfortably and they like sleeping. Yeah, so that is another area that I can say that knowledge really helps the farmers.
And so I think it's really important to point out that, as these farmers learn from, the volunteers we have in these communities, increasing milk production, as you heard this farmer say, not only increases their economic status, but also, their prestige, their status in their village as well. So it's really important work we've been doing to help them improve their livelihood. And, when it comes to climate change and crisis and addressing food security, farming as usual is no longer an option for these small scale livestock producers. And I think we at Vets Without Borders really want to be part of the solution to this problem and support the programming and improve the quality, not just the quantity of livestock. The approach we take actually takes two important forms. So first, we build a community animal health worker model that recognizes the importance of the gender element of livestock production, because women by far dominate the domestic labor in the household, and they play a pivotal role when it comes to biosecurity, as well as protecting the household. And so by training these women as these companion community animal health workers, it's more likely that the information will pass through both formal as well as informal methods. And that will improve animal rearing practices, sanitation, hygiene, and reduce the entire livelihood exposure to zoonotic diseases. So, why is there an increase in zoonotic cases? There are several reasons. Africa has the world's fastest growing population. There's a growing demand for food derived from animals, including meat, poultry, eggs, and milk. And with increased urbanization, what you're seeing is that these outbreaks are moving quickly to the rural area, as you've seen in the West Africa Ebola outbreak, and now in the Uganda outbreak, which actually reached Kampala a few weeks ago. And so to prevent this spillover, a One Health approach is key, an investment in these community animal health workers. And I can talk a little bit about that. These community animal health workers work at the community level. They are the first identifiers of these spillovers, and then they will alert the health officials and other community members to immediately stop the spread. So the second approach that our work takes is to then work through local partners and not create this large not-for-profit footprint overseas. The international not-for-profit sector really has historically created a parallel system with local nonprofits where they can set up shop in countries with these large offices. We can also have huge staffing and then subcontract small amounts of money to local organizations so they do the actual programming. It's really a blend of globalization and localization in the deployment of that model. And this is an approach that is contrary to developing like a local civil society that's been seen more as a colonial approach. So our model works directly through these local organizations. We're empowering local decision making so we actually can create a sustainable model. One of the other things we do is we also promote a gender transformative model. And a gender transformative model focuses on change at both the individual as well as the systemic level. Without the reduction of gender disparities in livelihoods as well as incomes and households, there will not be increased or improved food security. So what we do is we empower women, we hire gender equality specialists, so these women can learn to play an increased decision-making role at all levels of the community. And they do this through the community animal health worker model. And then they work with families to address these unequal power relations. We always choose to work with women organizations first, empowering their efforts as well as their voices. So our work also happens in the humanitarian sector, which is so interlinked to the international development sector, especially when it comes to things like climate crisis and food security crisis. So currently in East Africa, it is stated that a person is dying every 36 seconds due to food insecurity. And in South Sudan, 8 out of the country's 12 million people are facing severe hunger. The country has also been hit by extreme flooding for a 4th year in a row, which has affected almost 1 million people, forcing these communities to deplete their coping mechanisms due to a lack of resources and these back-to-back shocks. And on top of that, Russia's invasion of the Ukraine has caused donors to reallocate budgets. So while food price inflation has eroded people's purchasing power, it's also eroded the capacity of communities to help those that are most vulnerable. To top it off, the World Food Program has now cut nearly 1/3 of the people it planned to provide food aid to. That means it's actually stopped providing food to 1.7 million people that they were feeding up until June of this year. And when we spoke with the executive director of the World Food Program a few weeks ago, he said it was unimaginable that they were now taking food from the hungry to feed the starving. Here's another short video from our country director in South Sudan.
My name is John Ganiko. I'm the country director for VSF Canada. VSF stands for Veterinarians Sans Frontières, meaning Veterinarians Without Borders. We have been in South Sudan since 2013, implementing mainly livestock and livelihood activities, especially in states like Barghazali states. The reason why I am here today is to launch an appeal and to alert the world, the whole world, about the food crisis happening in South Sudan. In South Sudan at the moment, we are having more than 6 million people facing food crisis. This 6.8 million represents 55% of the country's population. The worst statistic is that out of these, 1.3 million children are facing acute food malnutrition, severe acute malnutrition. And again, more than 600,000 women, lactating women and pregnant women are also facing severe acute malnutrition. This is a terrible situation we are in.
So I want to switch now and talk a little bit about the record-breaking flooding that's been happening in Pakistan. Again, that's been blamed in part by climate change. It's affected 33 million people. 1/3 of the country has been submerged, and it's killed nearly 1,700 people, damaging more than 2 million homes, and overall wrecked damage that's estimated to be at a cost of $30 billion. It's also now stated that 1.2 million livestock were killed as a result, while millions others now live with displaced populations which have no resources left to care for them. Livestock are the core asset of rural households and a major source of household food, causing major risk again for food security to the infected population. In the affected areas where this flooding happened in Pakistan, 100% of the expected crops have been destroyed, which includes grain, cotton, sugarcane, and vegetables, as well as animal fodder have been destroyed. Our local partner, we've been working with the Women Senegal Foundation with decades of experience in animal health. They're working to specifically support 6,800 rural women families with milking goats to give them economic empowerment and provide food security to the household, animal fodder, and hosting an animal vaccination camp at the village level to prevent diseases such as foot and mouth disease. So what many of you might know, we actually also work in Northern Canada. This year has been our full year fully operating. I want to share with you this video by one of my colleagues, a veterinarian from Canada, Dr. Michelle Tuma, who will give you a brief explanation of our program there.
The Vets Without Borders Northern Animal Health Initiative was just operationalized this year. We were in pilot mode since 2019. And basically what we have been doing since 2019 is partnering with local communities who have reached out to try to establish a long-term sustainable program for dog management or animal management in their community. So the Northern model is really focused on community-led partnerships. We have a One Health focus, so increasing the health of the residents, their animals, and their environment, and really providing community empowerment to be able to lead these programs and to create, like I said, a long-term sustainable model. So currently, as of this year, we have 10 partnered communities, and then also 3 partners that are kind of like local organizations to the north. So what we generally have been doing with this is that we travel to the communities as we are invited to them, and we provide a temporary vet clinic. So that includes vaccinations, of course, for rabies, as well as other diseases for cats and dogs. It includes spay and neuter surgeries, as well as any other kind of medical or health concern that we are able to properly handle given our remote location. Sometimes we set up clinics in a fire hall or, in a school gym. So it's obviously not the same types of, environment as a regular clinic. In addition to doing the temporary vet clinics, as I mentioned, we do provide a lot of resources to the communities in how they are able to establish a program themselves to create awareness, education, and hopefully, again, have everything that's more community-led, that they're making the decisions on what is going to be happening in their communities regarding their dog populations. And I do want to say, like up north, it's generally dogs that we do see. There is like a handful of cats that we see when we go into the communities, but generally it's the dog populations that communities tend to have concerns with. And so, of course, that is a big thing too, because they can be the link between wildlife who potentially have rabies and humans. In terms of, there's a lot of logistics and funded needing, there's a lot of local partnerships. And so if this could be rolled out internationally, absolutely. And there's definitely some programs and models that are already in in other countries that have a lot of similarities with the program that we do. And we do find some parallels between those as well.
So this year, we've actually had the opportunity to visit 10 communities. You can actually see on the map on the lower right of the screen where we've had some of those clinics. And just to give you some statistics, we have vaccinated 665 animals. We've spayed and neutered over 220. We've seen over 680 animals. We've actually engaged school kids, more than 350 school kids, and we've actually trained some lay vaccinators. This is an exciting program for our Northern Animal Health Initiative. We've had a lot of interest from new donors. We've begun to show impact and progress towards what's really going to be hopefully a sustainable model. And I think what's most exciting for me and for all of us who do this work is that's really showcasing how this community animal health model can work in Canada as well as overseas and share that best practice and learnings. And over the year, we will work on defining what the community animal health worker model really looks like in the North. We envision that every community will likely have a different variation of the model as we begin to test out the different ways that we can deploy that model and actually develop local capacity. And so we have currently also identified focal points where we can do this, and we'll continue to engage with those individuals. We also offer different bursary and educational opportunities so we can develop animal health knowledge to the interested community members in these northern parts of Canada. And this program hosts volunteers every year as we rely on their generous support for our clinics. This year, our team has hosted close to 25 volunteers who I'm proud to say has consisted of veterinarians as well as veterinary technicians. So I want to sort of set the stage before I moved to the next set of slides where I'll introduce you to Alexandra, who's our program manager for the Ukraine. I think this year in March 2022, we all saw the horrific invasion of Ukraine by Russia. We were faced with a crisis unlike any other, and VWB, while we work internationally, and we certainly have not always worked in humanitarian crisis scenarios, for the first time, what happened was we saw companion animals were at the front of a war zone, and our staff and our board really wanted to step up and wanted to support. You know, about 10 million Ukrainians left their home as a result. As a result of the invasion of the Ukraine by Russia. Many of them had been displaced internally. Many of them had left the Ukraine seeking refuge in other countries. And while the exact number of displaced pets that existed is unknown, Ukraine was home to anywhere between 5.5 to 7.5 million cats and and at least 750,000 dogs before the start of the war. And in this tragedy, what happened, owners lost connection with veterinary services they used to rely on for the well-being of their pets, especially those that had to relocate to rural areas, often not being able to find veterinarians with the right qualifications to even care for their pets that were their companions. And also qualified veterinarians joined the war efforts. Some of them even moved abroad. Many of the clinics were destroyed or damaged. I personally had a colleague who was trying to leave the Ukraine with his wife and his 2 children, and he was actually shot to death at the border. So when the war started, our team immediately found exceptional local partners within the Ukraine. We sent a team of vets to assess the Polish border to understand what the needs were with the people and the animals fleeing. And after going to the border towns, refugee camps, train stations, it became clear to us that the greatest needs were actually within the Ukraine and not at the refugee camps at the borders. And so to give a bit of context, I've asked our program manager, Alexandra, to give a brief overview in this next video. Alexandra is actually from the Ukraine. We hired her as a program manager at VWB Canada in order for a Ukrainian individual to get refugee status in Canada. They had to be employed or have a job. And she currently is actually back in the Ukraine, trying to move her parents out. And unfortunately, the Russians have bombed the bridge that they were attempting to cross, and has actually been in a bomb shelter with her family. So I will now play this video for you.
Hello, my name is Alexandra and I'm Ukraine Program Manager at VWB. I will give you a brief overview of our work's geography in Ukraine. So here you can see a Ukrainian map with territories occupied 8 years ago. Crimea and small part of Donetsk and Luhansk Oblast, they were occupied in 2013 and 2015. Here is same map, but with signs of Russian invasion in February this year. Here you can see that northern, eastern, and southern borders of Ukraine were attacked by Russian troops. Also with the small fires, this bombing, shelling, missiles attack practically all over Ukraine. It's more than 7 months of the war now, and here you can see the map and number of air alarms Ukrainians had during this 7 months. Average duration of alarm is almost 1 hour. So you can imagine many people spending hours, days, and weeks in the bomb shelters, basements, metro stations. Situation is better now than it was in March and February, still very far from a good one. With green, you can see liberated areas. But liberated, it doesn't mean only they're under control of Ukrainian government now. It means also these territories are very damaged. Usually they don't have critical infrastructure, people's houses were destroyed, and a lot of animals on streets. With red marked, you can see territories occupied recently or territories with heavy combat still these days. This picture gives more ideas of where our partners located. We have 3 main partners: UPO, HappyPaw, and GladPet. UPO located in Western Ukraine. It's the most safe location now, safe territory, so they operate from there. HappyPaw located the main office located in Kyiv, in capital of Ukraine, and GladPet. Before war started, they had 2 locations: Odessa, like southern part, and Kharkiv, eastern part. We started to work with the Odessa branch, and now we coordinate our efforts more with Kharkiv, with people from Kharkiv, but we implement with them online projects, so it practically doesn't matter, but it gives us ideas of like where these people are from. Our main direction, humanitarian food and medicine, I mentioned that it is implemented by UPO, and they have 2 warehouses. One is located very close to Lviv in Ukraine, and another one is in Poland, very close to Ukrainian border. So UPO accumulates humanitarian aid in their warehouses, and after this distributes it to 12 or 11 now regions. And you can see here that UPO support, it's like food delivery and medicine delivery, covers all Eastern Ukraine and pretty much like Central Ukraine too. Spay-neuter surgeries. This program we implement together with HappyPaw. I mentioned they located in Kyiv, but they work in Central Ukraine. They have a lot of partner clinics, so they work also with animal welfare groups, with volunteers, with shelters, and support them with sterilization. Now it's almost 2,000 animals were sterilized during the last several months. Also, at the beginning of the response, we helped several shelters, and this is very impressive example. The shelter located close to Kyiv in Makariv. and it was practically destroyed by shelling at the first days of the war. Also, this shelter hosted a lot of animals from all this northern region. And now I believe it's home for more than 1,000 animals. We rebuilt premises for cats and also supported the shelter with heating, so they will have some warm premises during winter. Online veterinarian care. Project we are very proud of, and here you can see that our clients, mostly from, again, Eastern Ukraine and also from occupied territories. I was so touched to see feedback from pet owners from Kherson and village close to Mariupol. I understand that these people, they don't have good connection and they don't have internet usually. So they use maybe 10 minutes of their connection time to call our veterinarians and to ask about their pet's health. Also, our online veterinarian care, it works for other countries too. And we have clients now from Germany, Poland, Canada, Italy, and this number is growing. Here you can see the map of our partners' physical presence. Again, we try to support partners in helping people who are in the war situation, people who live very close to occupied areas, to combat areas, or people displaced from their houses because of war. So I hope it gives you more idea of our geography and where our partners and their work is located. Thank you.
So I wanted to also acknowledge that we have been working with a number of partners who are quite strategic on the ground. They are incredibly passionate, hardworking people. They inspire us every day. The first one, Yupo, I'll have Olga actually speak on this video. We started working with her on day 5 of the war, and I'll have her talk a little bit about the work they're doing.
Ukrainian Pet Association worldwide, because there are 3 of us, and I would like to share my screen for a moment, just to show you my friends and my colleagues, the founders of UPOM. So on the 25th of February, we started to find ways to overcome the humanitarian crisis that was approaching animals in Ukraine with the speed of Russian missiles. Nevertheless, this intention to launch an animal welfare organization wasn't impulsive. About half a year before, Oksana told me about her intention to quit her job at Lviv City Council and to establish a charitable fund or a non-profit organization to develop an animal welfare in Ukraine. And I promised to help her. So in February, we just called our friend Inna and started to work hard. All of us has many years of experience in the field of animal welfare and the track record of successful projects in this sphere, and each of us has our own professional experience, so useful now. So sometimes it seems that all life long we were preparing to be doing what we are doing right now. I couldn't even imagine that it is possible to build such a structure within such a short period of time. Maybe it was exactly this present circumstances that forced us to be so effective, so brave, and so quick every day. When you receive hundreds of requests for help every day, you have no other choice. And up till now, we have delivered more than 600 tons of humanitarian aid to Ukrainian animals, and we definitely can do more. The only limit is in the amount of humanitarian aid that we receive from our donors. And nowadays we cover about 50% of the total need in pet food and veterinary supplies for 120,000 Ukrainian animals. We managed to join the efforts of 16 organizations and arrange the network of local coordinators in each region of Ukraine affected by war. We always know the destination of each bag of pet food or box with veterinary supplies we deliver because we work directly with those in need without any intermediaries. And our innovative platform, upo.org, allows us to collect requests for help and to know the exact needs in each region. So we can schedule the deliveries in accordance with the current local situation, the number of animals there, and the estimated amounts of supplies needed. We are very thankful to Veterinarians Without Borders Canada for their trust in us at the very, very beginning of all this journey and for the provision of support that allowed us to build such a strong team that is the cornerstone of UPO and the current delivery campaign. And moreover, the team that is highly motivated for the future projects. As I said before, each of us has a strong background in animal welfare and extensive professional skills. And this allows us to develop into the first organization in Ukraine focusing on innovative management in animal welfare, aiming to provide support to local animal welfare organizations, shelters, local governmental authorities, and veterinary specialists. Right now, we are working on the spay and neuter campaigns in various regions of Ukraine, the project of mobile veterinary clinic for crisis management in the war-torn regions. We also launched fundraising campaigns for helping Ukrainian shelters aiming to purchase refrigerators and to construct cat adoption center for serious shelter in Kyiv, and also to buy a car for Shans shelter in Zaporizhia. And the future outlook of UPO comprises the capacity building program for Ukrainian shelters to change the way of their operation, conditions, and opportunities for animals living there. We also are looking forward to professional advice to local authorities on animal welfare and humane population management. Educational platform for animal welfare organizations, veterinary professionals for holding events, webinars, mentorship, to establish successful partnerships, to provide micro grants and any other assistance that they may need. We are looking forward to the translation of professional veterinary literature into Ukrainian language because we see an extremely high demand for it in Ukraine. We are ready to lobby a legislative reform for governing body for veterinarians of Ukraine, partnering with the Polish Veterinary Chamber. We have successfully established this cooperation as of today. And we dream of the construction of innovative animal welfare centers, providing perfect conditions and opportunities for animals and animal therapy for people. So while Ukrainian military forces continue doing their job, we continue doing ours with enough skills and passion for the love of animals. So thank you for your attention.
I'm also going to share a video from our next partner, Happy Poor.
Це справді розриває наше серце на шматочки.
Це моя мрія, цей будиночок був. Остальних нема. З літака скинули бомби на наш притулок. Це взривною волною вийшло.
Ми знайшли кошти для того, щоб відбудувати притулок. Це в наших таких найперших планах. І ми впевнені, що притулок стане ще кращим, ніж він був до війни.
Hello, everyone. Thank you for the opportunity to speak to you today. My name is Nina. I'm a fundraiser with Happy Boy Charity Foundation. The shelter you saw on that video is one of examples of all the horrors that thousands of animals across Ukraine have experienced during the last 4 months of this horrible war. This shelter was one of the best shelters in Ukraine, with such a beautiful area, with animals that were properly fed, treated, and of course sterilized. Also, this shelter was one of 120 shelters with which we have been working on the past 10 years in Ukraine. But then war came and everything changed. We want to thank you for your support. With the help of, with your help, we managed to quickly rebuild the damaged parts of Best Friends shelters, and now they can accept zones, and it's really written for us. And it's only one small part of titanic work that we have been doing for the last 4 months, just to help to rebuild these shelters that are damaged and prevent ecological disaster in Ukraine. In 2017, we sterilized in Best Friends shelter more than 200 animals, and it helped us to completely stop the growth of the population in this shelter. But today, a large number of unsterilized animals came to this shelter almost every day. For example, on the last week, 50 completely exhausted animals
I want to just also, as we close up, acknowledge our third partner. This is a GladPet, an online platform that we use to provide veterinary consultations. About 80% of the Ukrainians that are under the age of 45 have access to the internet, but those have also been affected by the war. So we provide remote consultation tools. They can use a video-based platform. They can use chat-based through a Telegram application. And for those who don't have internet, they can use phone lines so we can have pet owners book virtual appointments. We've been doing that through SmartVet, which is a Canadian telehealth veterinary service provider. And to date, we've actually done over 200 consultations, mostly related to behavioral problems like pet anxiety, aggressive behavior, loss of appetite, etc. We're also looking to build the capacity of 81 vets and community animal health workers through virtual training. So far, we in the Ukraine have helped nearly 150,000 animals. We've delivered 820 tons of food, 37 tons of medical supplies, and more than 5,000 animals have received veterinary treatment. And we've done over 1,300 spays and neuters. And finally, we've actually just deployed our 4th volunteer to Romania to support our local partner, Save the Dogs, that works at the border to the Ukraine. And this organization really has been working tirelessly to support the increased influx of animals across the border. The last thing I'll say before we end and I take questions, I see there are a couple in the boxes. We do have a volunteer sending program. You can contact us at vetswithoutborders.ca and we can provide information. We send volunteers into the northern program, to Romania and the south. We've sent 25 volunteers, as I mentioned, to northern Canada. The trips can be anywhere from 1 to 2 weeks, and usually are accompanied by the Northern Animal Health team, and the accommodation can be anywhere from hotels to guest homes, and we rely on the communities to support the needs of our volunteers during the clinics. We also have an international volunteer sending program that's funded through Global Affairs Canada. That allows us to send volunteers on assignments for 3 to 12 weeks. And with the current grant, which we're on, which is on year 3, we'll send 190 Canadian volunteers to both the sub-Saharan Africa as well as Southeast Asia, and they'll work with local partners to conduct training, as well as we'll have volunteers who are vets, students and vets, and they will there are other positions like communications, gender monitoring, and evaluation. So all our volunteers, I'll say, come back saying how much they love working in these vulnerable communities. They still love supporting the partner organizations and making a positive difference. And they definitely think that the experience is contributing to meaningful work. It allows them to share their skills. And I think when they come back to their normal lives or return to their normal day jobs, they definitely feel inspired and refreshed. And so I'll end there. And if there are any questions, I'd be more than happy to take those. And so I will just check the chat.
Yeah, can you see the Q&A, or did you want me to read it to you?
You can, I think I can see it. So the first question is, thanks, this is a great talk highlighting some amazing work. You mentioned outcomes. What are you measuring and how do you measure and assess these outcomes? Do these communities help create assessment metrics? So thank you, Emily. That's a great question. We certainly are looking at outcomes, I would say, with the Northern Animal Health Initiative. We actually have vet students who are doing summer research projects with us, looking at and a lot of it is quantitative, but the number of animals we've spayed, neutered, the number of animals we've vaccinated, maybe the number of companion community animal health workers we've trained. It's very sort of metric based on what we've actually done tactically. And as the programs to some degree are new, I think as we move forward, there are other metrics we will planning to look at to measure. The person you see in this photo here, Dr. John Van Looving, is an epidemiologist, and he's actually spearheaded a lot of the work with us, not just in Northern Canada, but in Africa. And so him and his students and teams really sort of work with us to give us guidance on what are rational or reasonable metrics we can measure. David, I'll answer your question. Is there a ban on bringing dogs into the US from the Ukraine due to rabies? So there is a ban actually in Canada. We recently hosted a webinar about this. And I think currently, from what I understand, there is discussion going on with the CDC. I am not sure what the current status is, if the ban has actually been implemented, but the ban did come into effect in Canada, and we recognize the impact this has on bringing dogs that potentially could find homes, but we continue to work in a way that, you know, allows us to still improve situations for these animals in countries like the Ukraine with spay and neuter programs that doesn't lead to increased number of homeless animals, and hopefully manage pet populations so we don't actually have as many animals that need to leave the country to get adopted out. And so with that, I want to just be cognizant of time. I know we're close to the end of the hour. If there are any additional questions, anything in the chat, please feel free to add those. I'd be more than happy. I see some of the questions that are in the chat. What organization do you work with in the Ukraine? So you saw it was UPO, Happy Pet, as well as Glad Pet for our telemedicine. Yep, I see that there is actually someone who put in some contact information. Thank you very much for that. I appreciate it. We can be in touch. And I think that was it. Let me know, Ginny, if I missed anything from any of the participants in terms of chat, you know, comments or any Q&A that I should address.
Oh, that's it so far.
Great.
Oh,
Great. Well, thank you all. This has been such a pleasure and honor to be with you today and to be able to share a little bit about the work I do. I did want to close with some comments. I know Dr. McCobb read my bio, and I want to say to all of you that whatever you choose to do in your careers as, you know, veterinary health professionals or some affiliated a veterinary profession, that you should be driven by a passion and your purpose for the work that you do. And for me, Vets Without Borders has been one of those passions. As Emily mentioned, the other thing I do is I really believe in how we can diversify our profession and really sort of serve the communities we live in, but also have representation of the veterinary healthcare professionals and paraprofessionals who look like those communities and better understand that diversity, equity, inclusion makes us a richer population. And so I'm so proud that I get to work with an incredible team of people. I'm really thrilled that I get to be here with you today and share a little bit about what that work is about. So thank you, Ginny, thank you, Emily, and thank you everyone for being here on the webinar.